Good morning. So, in the next part of the hematinics, we are going to discuss about the vitamin B12. Now, silocobalamin or hydroxycobalamin are the complex cobalt-containing compounds. They are present in the diet, and it is also referred as a vitamin B12. So, cyanocobalamin, hydroxycobalamin, it is a combined cobalt-containing substances which present into the diet and referred as a vitamin B12. Now, vitamin B12 occurs as water-soluble and thermostable red crystals. Clear? Vitamin B12 are the water-soluble. Clear? Water-soluble in nature. It is synthesized in nature by microorganisms, plants, animals, acquire it from them. So, it is mainly, you can say, this synthesized by the microorganism, and plants, animals are acquiring from them. Now this vitamin B12 again, it is an important compound for, you can say, that hemopoiesis. Now in case of the dietary sources, liver, kidney, of course you can say that it is a part of the meat, sea fish, egg yolk, meat, cheese are the main source of the vitamin B12. Clear? From this food we can get a high quantity of the vitamin B12. Only the vegetable source is the pulses, legumes or the pulses, which get it from the microorganism harbored in their root nodules. In the case of the pulses, the root of the pulses, the microorganism synthesize the vitamin B12, so these pulses they have the vitamin B12. Vitamin B12 also it is synthesized by the colonic microflora. Clear? Colonic microflora, but it is not available. Those synthesized by the colonic microflora, it is not available for the absorption. Of course, into the commercial sources, whenever we are talking about the commercial sources like Streptomyces, Griseas and all, it is used to produce the vitamin B12. Let vitamin B12. Daily requirement is very less, almost 1 to 3 microgram. Clear? 1 to 3 microgram, but pregnancy and lactation period, the requirement is increases and it is almost 3 to 5 microgram. Clear? It is the 3 to 5 microgram. Now, in case of the metabolic function of the vitamin includes, it is intrinsically linked with the folate metabolism. Clear? It is intrinsically linked with the folate metabolism in many ways. Clear? Many ways. Like megaloblastic anemia is occurring due to the deficiency of this also, vitamin B12. In addition, vitamin B12 has some dependent metabolic function as well. The active coenzyme form of B12 generated in the body, that is the deoxyadenosine cobalamin and methyl cobalamin. Next is utilization of the vitamin B12. So vitamin B12, it is present into the food as protein conjugates and released by the cooking or proteolysis in the stomach, facilitated by the gastric acid. So you can say that it is present into the food, released during the cooking or into the gastric juice. Intrinsic factor forms the complex with the vitamin B12. Intrinsic factor, it is one of the important constituent of the gastric juice. Now it will form the complex with the vitamin B12 attached to specific receptor present on the intestinal mucosa and absorbed by the carrier mediated transport. So what does it mean? Intrinsic factor is required for the absorption of the vitamin B12. Clear? Intrinsic factor is required for the absorption of vitamin B12. So it is transported in the blood in combination with the specific globulin transcobalamin 2. Clear? So it is transported blood in combination with the beta globulin transcobalamin 2. Congenital absence of this beta globulin transcobalamin 2 or presence of abnormal protein may interfere with the delivery of vitamin B12 to tissue. Then vitamin B12 is especially taken up by the liver cell and stored about 2 to 3 or to 4 to 5 body contains, clear, bodies contains of you can say that vitamin B2 almost 2 to 8 mg, it will be present in the liver. Preparation: cyanocobalamin, hydroxycobalamin, these are the preparation is available. Treatment of uses: treatment of vitamin B12 deficiency, prophylaxis. In case of you can say that if the patient required that and he having that chances of anemia or vitamin B12 deficiency. Megadose of vitamin B12 have been used in the neuropathic psychiatric disorder and cutaneous sarcoid and as a general chronic for the alligopathic improve growth, though their value is you can say that their importance is questionable. Next you can say that tobacco amplophia, in that condition also cyanocobalamin having some benefit. Adverse effect: large dose of vitamin B12 which is generally it is quite safe, but allergen reaction may be occur, but not for the vitamin B12 but mostly for the contaminant. Now next is anaphylactoid reaction may occur during the IV injection. Plus, so this is about the vitamin B12 and these are the some of the reference for further study.